This is a poster presentation for me in Auckland in June, and I think most of you are not so interested in mandibular anatomy, but this is very important for us for dentistry, for oral and maxillofacial surgeon. So this is a very useful information to the dentist or oral and maxillofacial surgeon. And the title is Can the distribution pattern of nerves and artery from mandibular accessory foramina be predicted? And do you know the mental framing, mental nerve, and mental arteries? The mental framing is a framing which is located inferior to the second premolars. More than half of them are located just inferior to the second premolar. Many of the dentists believe that mental framing is located between the first and the second premolars, but actually the inferior to the second premolar. And in this presentation, I can show you the accessory mental framing and nerves and artery. The accessory mental framing is, I can show you the definition. Is defined as a framing located around the smaller than the mental framing and shown by computed tomography to be continuous with the mandibular canal and smaller than the mental framing, regardless of the whether nerves and or viscera arise from it. Sometimes very small, but sometimes very large. In this picture over here, there are very large accessory mental framing, and they include the nerve and artery, and of course veins. But in this picture, the vein is not shown. This is a normal anatomy, but the distribution of mental nerve is also very important. They have the 3 to 4 branches of the mental nerve. The one is branches to the mental region. The one is inferior labial region. The one is angular region. Sometimes the branches to the inferior labial region is divided into two parts, the medial part and lateral part. In this research, I divided into 4 branches, mental branches. It's divided into 4 branches. And the reason why it is important for dentistry is this picture is shown during the procedure of the dental implant surgery. When we replace the implant fixture into the mandibular molar region, we always should take care of the mandibular framing, nerves, and arteries. So when we elevate the periosteum and gingiva, we should avoid the injury of the mental framing. Accessory mental framing is located around the mental framing. So if we find the accessory mental framing, we should avoid or injure the accessory mental framing as well. And recently, a lot of research about accessory mental framing was shown by using cone beam CT. It is called CBCT. It is very high resolution, but we cannot see the nerves and arteries in the CBCT. So I researched about a distribution pattern of the artery and nerves by dissection of the cadavers. And we reviewed the 63 human mandibles with overlying soft tissue that have been resected from donated cadavers in the Korea University School of Medicine. First, I examined the CBCT. 63 cadavers. And in 63 cadavers, 9 of 63 cadavers, 9 cadavers has the accessory mental foramen by using CBCT. And I dissected that 9 cadavers, 9 mandibles, by gross anatomical dissection and using a stereo microscope. And the result is here. Here is the anterior, posterior, superior, inferior. The center is the mental foramen, and the relative location of the accessory mental foramen is shown here. And the circle size is showing the size of the accessory mental foramen. Some accessory mental foramens are very large, like these. These are tend to located in the anterior and the superior part and very close to the mental foramen. These small accessory mental foramen tend to located far from the mental foramen, and the posterior and the superior part is a large number. This picture shows the CBCT image and gross anatomical dissection and the dissection using stereo microscope. And this blue shows the mental foramen, and the yellow, red, black show the accessory mental foramen. And the accessory mental nerves arise from the accessory mental foramen are all joined into the branch of the mental nerves, like this. So all of the accessory mental nerves join into the branch of the mental nerves, and the innervation is the same as the branch of the mental nerve. And some accessory mental foramen has an accessory mental artery, sometimes very large, sometimes very small. And some mandible has just an accessory mental artery without nerves. And this is the cause of the embryological development. This shows the cause of the accessory development of the accessory mental foramen. During the 12th week of gestation, mental foramen is formed with a bone addition to around the mental nerve. If the bone formation added to the peripheral part of the nerves, there makes a small accessory mental foramen, the peripheral part. If the bone addition is occurred close to the mental foramen, there makes a large accessory mental foramen. These are the other clinical case report and anatomical case report of mine, and they show the other accessory foramina of the mandible, not a accessory mental foramen, but there is a accessory foramen of the mandible. This is a accessory foramen of the mandible ramus, and this is a very interesting finding that there is a large medium perforating canal of the mandible, and I can find this accessory mandible perforating canal has the artery, which is a branch of the sublingual artery and the submental artery. So in this research, I found that close to the mental foramen, the accessory mental foramen located close to the mental foramen, they tend to be large and include the nerves not an artery. So in the clinical setting, we should avoid the large and close accessory mental foramen of the mandible, not avoid injury during the surgical procedure such as implant surgery or periodontal surgery and periapical surgery and oral surgery as well. And this is all my presentation. That's all. Thank you.